So I just checked patient records. I do have a female that needs a Foley catheter inserted. Before I go in there and introduce myself, I'm going to double check if I need any kind of PPE, which I don't. I'm going to double check any kind of allergies to latex, iodine specifically, because iodine will be used unless the patient's allergic. I'm going to look for incisions, any kind of immobility, problems with moving. So the patient doesn't look like she has any kind of issues, so we're going to go in there, we're going to introduce myself, and we're going to get started. So, knock, 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 close the door, close the curtain, performing my hand hygiene. Hello, my name is Kayla. I'm going to be your student nurse today. So the doctor has ordered a Foley catheter on you. So the first thing I'm going to do, as you can see, I have all of my materials gathered here, is I'm going to make sure the lighting is good. I'm going to place you in a dorsal recumbent position, and we're going to go ahead and get started, okay? So I'm going to remove this pillow. Don't grab your patients by the throat, though. I'm also going to take my bath blanket, and I'm going to cover my patient to keep this patient comfortable, because this is a pretty invasive procedure. So she's covered. She's in a dorsal recumbent position. We're going to make sure everything is ready. So the very first thing I'm going to do is, after I perform my hand hygiene, get my patient all covered up to make sure her privacy is protected. I'm going to put on my gloves. These do not have to be sterile gloves right now, just because I am going to wash the patient. This is a good way to prevent infection, and if done properly, it should prevent the infection, and it will be done 3 times in this procedure. So I'm going to go ahead and make my mitt. Alright, I feel it would help if these were actual size washcloths. Alright, so I have made my mitt. I'm going to do one corner, and we're going to go from top to bottom, or pubis to anus. So we're going to go ahead and spread, and we're going to go down. Then we use the other corner, down, and then we're going to go ahead and flip our mitt and use 2 separate corners to get inside the lip. So we're going to go down, and then we're going to go down. All right, so then I'm done with washing the patient. I'm going to go ahead and perform my hand hygiene. It's fine. I'm going to perform my hand hygiene, so now I'm getting ready to start the procedure. So she's already in her dorsal recumbent position. This is when I need my sterile field. So this is going to be my sterile field right here, because I don't have a bedside table. I have these extra set of gloves in case I need them. So, and the bed is at waist level, working height is good. I'm going to be standing on the patient's right hand side because I am right-handed. So we're going to go ahead and start the procedure. So this is my sterile catheterization tray. So we're going to open this very carefully. And I'm going to use this as a trash can for later use. And in your chart, it does say that you are allergic to iodine. Is that correct? Yes, okay. That is a very important question, because iodine would have been used in this procedure. So we're going to go ahead and open this in a sterile fashion. I can't see. Okay. Making sure not to contaminate the inside. So the bottom of this container is not sterile. And we're going to mind our 1-inch borders. All right, so I'm going to move this over here. The first thing I'm going to do is don my sterile gloves. So I'm going to make sure the cuff is towards me. And I'm going to use my extended clean surface right here. Move this down. And we're going to snake our fingers underneath these flaps. If these were a normal set of sterile gloves, you would start from the top, then go to the bottom, and then open the interior flaps. But these are not. So I'm going to go ahead and start with my dominant hand. I'm going to grab the cuff, insert my hand, palm up, and leave any kind of alterations to the glove until after I get done. So I'm going to go ahead and snake my 2 fingers underneath the second cuff, leaving my thumb out. That didn't happen. Okay. Leaving my thumb out. I'm doing this for purposes of showing you. Alright, so this obviously needs some alterations. So I'm sterile to sterile. I'm going to fix my fingers. And I'm only going sterile to sterile. Alright, so now I'm going to discard of this properly, keeping my hands above my sterile field. So the next thing I'm going to do is I am going to airplane my waterproof pad underneath my patient. And for make-believe purposes, we're going to pretend the patient can definitely move by herself, but I'm just going to make do. So, keeping this up and away from myself, we're going to mind our 1-inch borders here as well. And we're not going to reach over anything. Alright, so the waterproof side is towards the camera. I'm going to fold my hands in a makeshift airplane, and I'm going to airplane this under my patient. Alright, and the patient helped me move, but I'm going to move the patient because it is a stuffed animal. Thank you. Alright. So the next thing, still sterile. This is going to be another waterproof pad. I'm going to open it. It's definitely a nurse's preference on what you prefer to do with this. I'm going to use it to extend my sterile field, to make my work surface a little bit larger and more convenient. So again, waterproof side is going to be down, which is facing you guys. And I'm just going to extend my field. All right. Now I have another one, which is a fenestrated drape. I choose not to use this, but you can also use this to extend your sterile field as well. But I'm just going to discard of this. All right, and the patient stated that they were allergic to iodine, so we're gonna go ahead and get rid of this pack of iodine as well. All right, discarded. So now I'm going to prepare my materials. I'm going to move this, and in my preference, I choose to put the isolated materials, so my cotton balls, my hydrogen peroxide, my tweezers. Everything that I need is going to be right here, but the first thing I'm going to do is I'm going to take out my urine sample cup, because I am required to take a urine sample as soon as the patient is catheterized. So I'm going to go ahead and put this on my side table that is also clean. Alright, so I'm going to go ahead and prepare. I'm going to fluff my cotton balls. Can you see? Okay. I'm going to fluff my cotton balls. I am going to take my hydrogen peroxide and I'm going to dump it all over my cotton balls and then discard. I am then going to open my pack of lube and lube the first 2 inches or more, depending on the patient, of the catheterization tube. So we're going to open that. We're going to discard. I'm going to take my catheterization tube out of its packaging very carefully so it does not go crazy. We're going to discard this, and I'm going to lay this in the lube. The next thing I'm going to do is I'm going to take off the cap to my syringe, and I'm going to carefully discard this so I don't have to. Okay, I did not turn my back on my sterile field. And then I'm going to attach this to my catheterization tube. This is just to make it easier for me when I get it inserted. So I can see right now that the bag is clamped, so we're not going to have any leaking. So I'm going to go ahead and get started. So from here on out, this is going to be my non-dominant hand. This hand will not move from my patient. So I'm going to go ahead and I'm going to grab the patient and I'm going to spread them apart. And I'm going to take my cotton ball and I will go from one labia to the anus and then discard. And then I will go the other one down to the anus and discard. And I'm not crossing my sterile field. And then I'm going to go to the other labia on the other side again and discard. And then the other labia on the other side and discard. And then I'm going to take this last one and I'm going to go right down the middle to make sure the patient is sterile. And then I can go ahead and discard these as well. All right, so now my hand is still here. This is still my sterile hand. So what I'm going to do now is I'm going to take my catheter tube and I'm going to insert it. And with a woman, you insert it 2 to 3 inches or until you get a urine return in the tubing. So I'm going to take my tube. I'm going to hold it about, and it's a preference, but I'll hold it about 3 to 4 inches away from the end of the tube. And I'm going to start inserting. All right, and this is where I get some urine return. So I'm going to go ahead and inflate my catheterization tube while supporting it with my non-dominant hand. So we're going to use all 10 milliliters of this fluid to inflate the bubble. All right, and then we will remove this. This will keep it inflated. This can get discarded per facility policy. I'm just going to throw it away. That's my facility policy. And then I'm going to lightly tug on the catheterization tube until I feel a slight resistance. Now, the other time I would feel a slight resistance is with inserting it. If I were to have any kind of resistance when inserting the tubing, I would just twist the tube. I would not force it. So I'm going to go ahead and remove it. Okay, I feel a little bit of resistance. So I'm going to go ahead and take this out. And I'm going to set it here, and I'm going to lightly secure it to the patient's leg. And then this is when I would collect my urine sample. And so after I've collected my urine sample, I'm going to attach this to a part of the bed that is movable with the bed. So if we raise it, lower it, if the patient needs to move, I'm going to make sure there's enough slack. But then after that, I'm going to take off my gloves. I'm going to perform my hand hygiene. I am going to lower the bed, raise the rails, place the call light within reach of the patient. I'm also going to double check that the patient does not have any excess lube on the labia. So if there was, I would then go ahead and grab my wash basin again, grab a clean washcloth, and wash my patient again. So that is all. I'm going to remove my supplies, make sure you're comfortable, make sure you have enough slack on the leg strap so you don't feel like you're going to tug on it, and I will get out of your hair, okay? Thank you.